My name is Jenna Daly. I am a licensed clinical social worker. I'm in private practice and I've been working in perinatal mental health for over 10 years.
Hi, my name is Monica Munezero. I am a clinical social worker.
Felicity Colangelo, and I have a private practice.
I mostly work with children, but I also work with adults. And I'm a mother.
I have most recently started focusing on the needs of neurodivergent women and AFAB people who are birth givers. My early work in perinatal mental health started quickly to focus on loss and trauma. So I've been working specifically in that realm. And
Postpartum trauma and mental health issues affect a significant number of parents, yet these struggles remained under discussed.
Really highlights the importance of how you're treated during labor and delivery and through the perinatal process, through early parenting, parenting in general, I would say, and felt this calling to do this perinatal work, primarily because of my experiences postpartum and realizing the lack of resources and lack of support that was out there and how much I didn't know about how hard it was going to be.
Help is needed, there is nothing wrong with asking help. And whatever is good for the parent is also good for the child.
Actually naming the collective beliefs or the collective attitudes that we all sort of passively are consenting to or not able to challenge.
Once you become a parent, you think like, okay, you're supposed to do it all by yourself. But that shouldn't be the case. I think it's about normalizing asking help and not feeling like just because you ask for help doesn't make you any less of a parent. The idea that parenthood should be a time of happiness and joy may lead to a dismissal or downplaying of struggles like postpartum depression or anxiety or baby blues.
I typically hear is my mother said it was fine and everything was great. You'll be fine. I was fine. You're okay. White knuckle through it. And that is not true. And it doesn't go away, right? I think when a person initially comes into a provider is usually some kind of trying to contain it.
The idea of being a good parent, um, especially during the earlier stages of parenthood, this includes expectation like immediate attachment between parent and baby.
I've noticed a real connection with individuals who consider themselves like type A or high achievers, really struggling and having mental health, a lot of anxiety specifically, but can be anxiety and depression. Individuals who have gone through their lives thinking that if they just work harder, everything will be okay. And then in parenting, it often is not the case. It's like working harder is not getting them where they think they should be. And so creates so much anxiety and can lead to depression as well, of this feeling of like, I'm not doing this right. This isn't what I thought it was going to be, and kind of the self-blame that can come along with that.
I would argue that some of the things that have been said about type A women, that many of those women may be 2E or twice exceptional. That is, people who do high intellectual processing, not necessarily high achieving, high intellectual processing, and another neurodivergence.
I really appreciate you bringing up the quote unquote type A parent. I think a lot of people use that language. I'm type A. And if we could expand on what that language may or could also mean, I think that would be super helpful to equip people with more language.
Yeah, I absolutely agree. I think that it is a way, unfortunately, of trying to explain that unintentionally puts it back into the you should just relax. Also, many neurodivergent women and AFAB people do not know that they are neurodivergent. The vast majority of us are learning as our children get diagnosed or identified at best.
What kinds of experiences or exposure in people's lives put them at risk for compromised mental health during the perinatal time? Like what leading up to the perinatal time is a risk factor?
Sexual trauma is really something that a lot of people don't know. Going into this stage of life can be brought up, even if you feel like you've done a lot of healing, such a vulnerable time. Attachment trauma or attachment stuff with caregivers, especially. So parent relationship, and then being under-resourced for various reasons. So whether it's socioeconomic under-resourcedness or self-imposed, which is unfortunately part of how we're socialized to not ask for help, to assume we don't need help. We shouldn't need help, I would say, can lead to a lot of folks not having the resources that really are needed and can create a lot of mental health challenges.
And we do live in a culture that has pervasive judgment, both on how attached we're supposed to be, what that means, right? As well as also we're supposed to be fostering independence. It's a lot of conflicting messages around that.
It reminds me of masking, and it also reminds me of shame. And I feel that shame hasn't been a prominent part of this conversation, the way shame holds this all together and potentially leads to that delayed seeking of help.
Well, that brings in, and also when you're talking about culture, right? We tend to live in a culture that is focused on active helping rather than supporting, right? It's an effort to move the emotion quickly as opposed to letting the person sit in the emotion and understand themselves where it's coming from and have a natural progression to relief.
What is a trauma? And is the first thing that comes to your mind the only definition of a trauma? I think a broader definition or more working definition of a trauma, if you wouldn't mind touching on that a little bit.
We see people in our office every day that have experienced trauma, and it really is more about how you feel about something that happened versus what actually happened. And so something as simple as what a provider said to you during your birth experience can be very traumatic. Trauma is not what happened to you, but what happened inside of you in response to what happened to you. And so I want everyone to like reconsider what you think trauma is, and does it have to like qualify based on what other people think or what other people have experienced? Because really what the only thing that matters is what you are feeling and what you've experienced.
I know that for many women, especially people who grew up socialized female, there can be a strong tendency to say, it was fine, it was no big deal, I'm okay. And to even take a sense of pride and self-respect around no need to make a fuss. And I think that having someone else say, yeah, if you're suffering and you're continuing to suffer, it's not a short-term suffering. Let's get you some resources. I don't know that people are prepared with skills and tools for making sense of the complexity of their whole perinatal time. It may be the birth, or for some people, fertility challenges or conception challenges, or a very challenging pregnancy. And I think if there is even support out there, it tends to focus solely on the birth, like that 24 hours of the birth, and not that broader picture.
Problem that I'm noticing is in the postnatal care, it's not like they don't provide as much support as they do prenatal care. Prenatal care does pretty frequently, especially after I think you pass 36 weeks when that you have to go every week. Whereas once you give birth, there's not that many follow-ups. And there are some things that fall through the crack. And the support that they were getting before from their healthcare provider is not there, and they're left to figure it out. And there's those many changes happening. And for some people it becomes okay, how can you juggle all of that, right?
I think our minds are naturally inclined to, when we hear the word trauma, to go toward of the harms that can happen to us or that we can endure, the abusive side of things, like an abuse occurred to us, but the neglect side, where a thing that could have happened or should have happened or we would have benefited from happening did not happen. I don't know that we spend enough time talking about the way we may have been neglected during that time, the healing that may still need to happen as a result of not being well supported during a very demanding time in our life.
The lack of knowing what support should look like. The lack of knowing what you're missing out on or how you should be shown up for. Huge. And when you go back to that definition of trauma, I see that kind of trauma actually a lot more often than the on paper big T traumas. I see the people coming to me saying, I wasn't taken care of. Nobody was there for me. I was alone in it. And, maybe they've realized that they did deserve more support, but there's still that trauma there from not having that support. And I want to just label the grief piece because I think that people have a hard time remembering or understanding that that's actually what happens, is that we experience grief in not having the need for it being what we thought it was going to be. Oftentimes I see people covering that grief up because they can't identify it as grief because it feels like somebody should be to blame. And so again, a lot of self-blame happens. That's the guilt, as we have been socialized to do, applying the self-blame of I should have done better. I should have found more resources or done this trick that someone told me to do, or did the thing that the person who wrote the book told me to do. I should have done all those things differently and then it would have been fine. It's all on me. And it wasn't you. It wasn't you. And didn't have maybe access to the resources that we now have access to. You did the very best you could with what you had. And so offering some compassion to yourself and some empathy for everything that you've gone through.
A lot of parents in their first weeks and months of new parenthood experience a kind of anxiety they've never felt before, having never cared for someone so helpless. But how would an individual start to ask themselves the question, maybe this is more than just the normal amount of anxiety. Maybe this is actually a more serious level of anxiety. What would some symptoms be that would help someone think, this might be more serious?
You are going to feel anxious sometimes. That is the normal human state of emotions, but not all the time, right? Like that's the difference.
So with anxiety, I would say when they're continuously experience intrusive thoughts, racing thoughts, nonstop, it's preventing them from even caring for themselves, or it's making it difficult to care for their child, also impacting their sleep, appetite, their daily functioning. That's when, it's important to seek help.
I think that's important to know because I think embedded in the definition of motherhood is a type of martyrdom that normalizes our suffering instead of saying, whoa, suffering doesn't have to be part of motherhood, nor does martyrdom have to be the definition of motherhood. Things we did not have a grasp on or did not understand 5, 10, 20 years ago that we are currently having a better understanding of.
So the understanding over time within like perinatal mental health professionals has really increased. We've learned a lot more about PTSD. When people were referred to me specifically, like I think they have perinatal anxiety, 8 times out of 10, what was happening was emotional reactivity out of trauma.
CBT, which stands for cognitive behavior therapy. So it's a structured, time-limited therapy focused on identifying and challenging negative thoughts, those thoughts pattern, behaviors that contribute to emotional distress. So teaching coping strategies to help people manage anxiety, depression, and other issues would be helpful. And it's usually best for people who might have been diagnosed with PTSD, anxiety, depression. And there's also dialectic behavior therapy, DBT. So it's a modified form of CBT that emphasizes acceptance and mindfulness alongside the development of skills in managing emotion, relationship, and distress. And that is best also used for people, who have been diagnosed with PTSD or severe anxiety. There's also EMDR, which is the eye movement desensitizing and reprocessing. So EMDR is a trauma-focused therapy that helps people process traumatic memories by using bilateral stimulation, such as guiding eye movements to facilitate the brain's natural healing process.
Whether it's anxiety or trauma or grief, difficult and challenging feelings attached to an entry into parenthood that didn't go perfectly smoothly.
Normalizing those conversations allows for both recognition and healing when people realize that they're not alone. They are more likely to seek out healing resources by being able to open up about struggles. Individuals are better able to support one another, to share burden, ensure that both parents have the emotional space they need. And the other one is improving outcomes for children. So when parents receive mental health support, it benefits not only their well-being, but also the health and the well-being of their children. Because when the parents are emotionally supported, they're more likely to engage positively with their baby. And just because you didn't receive help at the time doesn't mean that it's too late.
What you said about normalizing the conversation about the need for support helps new parents get past that initial feeling of shame that they've done something wrong or they're not doing it right or they could be doing better. So that emphasis on when you're tended to as a parent, you're better able to tend for your child can really help people take a deep breath and choose their well-being. What would you say to someone who may have become a parent many years ago, but may have never received adequate support for what they went through? What would you say to them today, many years later?
I would say that we don't say that for the experiences that we had in childhood. We don't say that for the experiences we had in our early life. Like, processing your trauma can relieve tension that is contributing to other things in your life, right? So that you feel more internal resources to deal with the things that come up in your life.
First of all, it's okay to not be okay, right? We always say that, but I think it's really about putting that into practice and being able to facilitate those conversations, being able to have openly share those conversations. That's what I'm hoping that this will be the takeaway, is being able to have those conversations. And again, to be able to dismantle the stigma that comes with it and saying, you know what? Again, it's okay not to be okay. Let's figure this out together. It's never too late to seek the support you deserve.
It is never too late to do the work. So if you're still feeling like there's something left, if you're feeling like parenting's been really hard, there's a direct link with infertility, fertility issues, trauma, early on challenges to struggling and parenting. Like it really can set the tone. It can really make things hard.
I support women who come in to process their trauma later because the early years of parent are you're in the weeds. You can't even see up above that, right? You're so in the weeds, what I like to call full body parenting, right? That you might not really have the space to do that.
Processing what happened and learning how to cope with those feelings can help you find closure, regardless of how many years have passed.
Are your sensory needs receiving accommodations because we don't get a 504 for motherhood or for parenting?